back to the general slides. I'm going to click Go Live.
Not yet.
Oh, now I see screen.
Good practice. Good evening, everyone, and welcome to our third annual People's Opioid Summit. My name is Shane Willis, and I'll be your host for this evening. We're kicking things off with our amazing evening of information and inspiration. Over the next few hours, we'll hear from several people that include subject matter experts, people with real-life experiences, and individuals with inspiring information that can help those who are being impacted by a substance abuse disorder in any way. We hope you'll plan to stay for the entire event, or make it a point to go back and watch any of our speakers and segments that you don't see tonight on the PRISM YouTube channel. Also a reminder, this event will continue through the weekend as we have 2 additional days of activity taking place as part of the summit. You can join us in person here at the American Institute of Healthcare and Fitness in North Raleigh, or be a part of the summit virtually from the comfort of your own home or workplace. Visit peoplesopioidsummit.com to see the full lineup of topics and speakers. Then purchase your pick your price ticket and make plans to join us in the next few days. As I mentioned, so many great speakers here tonight, and we're going to get things kicked off right now. Our very first speaker for the People's Opioid Summit is Virginia Krieger, who is the co-president of the Lost Voices of Fentanyl. Tonight, Virginia is sharing some very powerful information about fentanyl, facts, history, and education from the perspective of bereaved families. Please join me in welcoming Virginia Krieger.
All right, and I'll be pushing you in 1, 2, 3, 4.
Good afternoon, everyone, and thank you for having me. As soon as we have the share screen set up, we can get started on the presentation. Can everyone see the slides? Okay, great. This is my daughter, Tiffany. Tiffany was not somebody that you would expect to be impacted by an opiate crisis. She didn't have substance use disorder. She was a young mother. She was a semifinalist on American Idol twice, and she was my best friend in the whole world. In 2015, Tiffany injured her back, and an acquaintance did something that happens every day in our society, offered her what looked to be a Percocet for her back pain until her neurosurgeon appointment in a few weeks. Unfortunately, that pill was a fake pill. It contained pure illicit fentanyl, and it claimed her life. Tiffany's story, unfortunately, is not rare. It's becoming the norm in our society. So most of you already know what fentanyl is. It's a synthetic opiate. It's 50 times stronger than heroin, 100 times stronger than morphine. They're currently making this fentanyl. It's turned into something new. In the past, we've seen it used for clinical use, but now we have street versions of fentanyl out there that are very different than pharmaceutical grade fentanyl, and they're made without any regulatory controls or any kind of standards or mixing practices. So let's talk about how this got started, and let's start by covering the old drug crisis, which we're used to. You know, in the past, every drug crisis for 50 years has been the same. People would go out, they would use drugs recreationally, or they would be self-medicating, and they would become dependent on those drugs. They knew what they were consuming. So for the most part, if they went to go see the dealer and they wanted a heroin or they wanted a Percocet, that's exactly what they got in 99% of the cases. And in the old kind of drug crisis, they would have 10 to 20 or even more. Some people have lived up to 40, 50 years who have an existing substance use disorder, but they had all those years of opportunities to get clean or eventually die either from complications due to their condition or, in many cases, classic overdoses, which we're all familiar with. Drug-related deaths for 50 years all remained within the addiction substance use disorder community. Very, very few ever came from outside of that community. And this was the pattern. that we became accustomed to for more than 50 years in this country. And this is the pattern from which all of our experience, from which everything we're drawing right now is based. But let's talk about what's happening today. Let's talk about what's going on with fentanyl. We have an influx of lethal counterfeit pills, something that we've never had before. The United States has been extremely blessed, to be honest, up to this point, that we've never had a problem like this, but we have one now. People who are counterfeiting trademarked pharmaceutical grade products, and they contain none of the medication which they advertise they contain illicit fentanyl. We have all these newly contaminated party drugs, ecstasy, cocaine, methamphetamines, heroin, any drug in which they have been able to include illicit fentanyl, they're pretty much putting it in. And in a large portion of the cases, the users do not know that they're consuming illicit fentanyl. So they're not getting what they want. They're getting fentanyl without knowing it. And there's approximately a 1 in 20 chance of instant death every time they use or consume a street drug in the current market. And it's affecting all segments of our population. This is not limited to any one group anymore. In fact, the random nature of it is what makes it so scary. So how did we get here? China began manufacturing illicit fentanyl roughly around 2013 and started mass shipping it to the United States. At first, it was coming through the mail. We managed to shut down the mail. And then in 2019, under pressure from the Trump administration, China banned fentanyl production, but they never stopped. What they did instead was they started manufacturing the 4-ANPP precursor. So kind of like a cake mix, they started making this precursor. They trained cartel chemists how to complete the method in a one-pot method, and they started mass shipping the 4-ANPP directly to Mexico. And now they've taken this highly lethal drug and they put it in the hands of the world's greatest drug traffickers. And those drug traffickers are right next door. 4 months after they agreed to ban production, 25.7 tons of illicit fentanyl was seized by the Mexican Navy. It was bound from China to the Sinaloa cartel in Mexico. And just to give you an illustration, 25.7 tons at 2 milligrams per dose was enough to kill the entire global population 1.5 times. So China has never stopped. So again, we have the two separate crises. We have the opioid crisis pre-2013, the one that we all know so well, where people would use a drug. They would get what they intended to get. They would become dependent on that drug. They would have 10 to 20 or more years of opportunities to get clean. And drug-related deaths remained limited to the substance use community. And lethal counterfeit pills did not exist in that old drug crisis. Now let's move to what's going on now. They get the fake pill or they take a drug. They don't know it contains illicit fentanyl. They have a 1 in 20 chance of instant death. Drug-related deaths are coming from all segments of the general population. And over 21 million of these pills were seized by the DEA in 2021 alone. And that number has gone up significantly in 2022. 40%, and this number needs to stick in people's heads, 40% of the pills tested by the DEA contained lethal amounts of illicit fentanyl. So when we look at this chart, we have to ask ourselves, we can see the difference, the change in the scope of how rapidly fentanyl overtook everything. You know, we're coming right in the heels of the Sackler-driven opioid crisis. And what happened was that started overlapping with this new problem of illicit fentanyl. But when you look at the charts, when we're looking at the numbers for the synthetic drugs, they were non-existent in 1999. I mean, they barely were a blip on the radar. And in fact, if you look, every drug, all these drugs remained on a fairly linear pathway in their growth ratios over time. Now, this was a phenomenon that was noted by Dr. Thomas Kuhn when he was predicting what fentanyl-related deaths would be in the future. And the interesting part is that he was giving a lecture in 2009. I was watching this lecture in 2015. So I'm watching it 7 years later, and he had predicted the drug-related deaths would be pretty much where they were right over here in terms of the fentanyl-related deaths or drug-related deaths as a whole. Well, I'm watching this and I know that he's wrong. I know he's wrong because I'm looking at the current scale of this needle going straight up through the roof. And so what changed? What changed so significantly that we went off the predictable linear line? And we don't know why it was linear, it just was. And we could predict pretty much what those deaths would be based on the old drug crisis. Is it population? Is it demographics? We're not really sure. But something really significant happened right in here. And so when we started to look at that, what we realized was we had an entirely new demographic involved. This demographic included people who never died before, people who would try a drug once in a while on the weekends and go out with their friends, people who self-medicated once in a while, people who never got addicted in the past, who never came onto our radar. You know, they would go on with their lives, move on, and everything would be fine. And we never had to deal with that demographic, but we have to deal with them now. You know, these pills are in middle schools. We've got children and young people dying. And so when we're talking about these two overlapping crises, the words we use to define what they are really matter. So we have an overdose. We all know what that is. An overdose is when someone accidentally ingests excessive amounts of a known substance with or without instructions for safe use. The key factor is a known substance. Now, overdoses still happen every day. And we're all very familiar with what those are. But let's talk about what a poisoning is. An act of deception. Anytime a person disguises or hides a harmful substance as something else or puts it in anything, no matter what it is, for another to consume without their knowledge or consent, that is a poisoning. And the solutions for these two problems are very different. The key factors here is the act itself. We're not saying that fentanyl, which is, by the way, a great prescription medication, the clinical versions, we're not calling fentanyl a poison, but it is the act, knowledge and intent. Overdoses include the knowledge and the intent to consume a specific substance. Poisonings do not. Now, this doesn't make any victim better or worse than another. Both are horrific and terrible. But the most important part is that we characterize these right and categorize them right, because the solutions for the two different problems are extremely different. Up to now, we've only been addressing one half of the problem, which are the overdose piece of it. And who is this affecting? This is the new faces. These are the faces today. 17-year-old Zachary Didier, 15-year-old Isaiah Gonzalez, 17-year-old Selma, 15-year-old Olivia Green. This is the face of this new crisis. You know, it's getting into our teen population. It's in our college student population. It's hitting young mothers like my daughter, who she wasn't in that category. She wasn't one of those people who would benefit from a recovery center, a needle exchange, medically assisted treatment. None of those things would have helped her because she didn't need those things. Now, those things are great, and we do need them, and we're heavily supportive of all the things we're doing for SUD, but we have to keep in mind there are two distinctly separate populations being impacted. So what we have been doing is trying to show where this distinction has happened. This chart is extremely significant. If you look at this, look at the fentanyl ratio on the streets in 2015, and look at it today. Fentanyl is displacing all the other drugs out on the black market at a much faster rate than we predicted. Fentanyl is not the drug du jour. It is the drug of the future, and they are going to continue to come up with new synthetics every day because synthetics are the future, and we have to get on board with that. Heroin is rapidly disappearing. The same is true of meth, although there's been a push, but as soon as they come up with a synthetic stimulant, you best believe that meth will be next to go off the table. The cartels are looking for faster, easier ways to make their product, cheaper ways. And with these synthetic drugs, they do not have to worry about harvesting plant-based drugs. They don't have to worry about having staff to manage them. They don't have to worry about weather conditions. All they have to do is place an order to China, and it gets delivered, and they finish it off in a one-pot method, and it's out on the street. And so this is the new face of what we're dealing with in terms of the drug trafficking methods. The thing that's also very significant is look at the age change. Previously, we did have a smaller dip, but now look at the youth impact levels for the ages 15 to 25. They're at the highest part, and they're going to keep going up. Now, there's another notion we have to stop considering or start considering is that, yes, most of the drug use among our young people, a lot of it comes from stress and situations where they don't know what to do. The lack of mental health care is a significant problem. But there's another factor we cannot forget. In this generation, drug use is as much a rite of passage as alcohol use. You know, yes. Okay. So the teen deaths are going to continue to go up. We're finding these pills in middle school. So what can we do? We're already doing everything we can for addiction solutions. We've gotten naloxone. We're doing the services. But what can we do for poisonings? We need to adopt a whole of society approach. We need to start working on increased interdiction and get this out of the drug supply. Public safety alerts have to be put out by everyone and educate the public. It can happen to them. And we need to put out fentanyl safety instructions for people who encounter them. If we can work together and bring these two solutions as one, then we can actually make a big difference. And we won't have to have displays like this in the DEA museum with all the victims who've been lost to illicit fentanyl poisonings. And we can go back to treating what we know. So I hope that all of you will join us, that you'll process this messaging. If you have any questions, you can reach out to us at Lost Voices of Fentanyl, and we will be more than happy to answer them. We have free posters and materials. And we're trying to just get the warnings out there so the public understands this is an all of us problem, and it's going to take all of us to fix it. Thank you so much.
Thank you, Virginia. A very, very powerful message for everyone here tonight, an inspiring message for everyone to take a step forward and get involved in how to get these drugs off the street, as you mentioned. Right now, we'd like to take a quick moment to thank our sponsors, a huge role in the People's Opioid Summit in helping make this possible. They include Cloaxo Naloxone Nasal Spray, Sunrise Community for Recovery and Wellness, the Yana Connection, Morse Clinics, and our hosts here at the American Institute of Healthcare and Fitness. Thank you again for being part of the 3rd Annual Opioid Summit. Coming up in a few minutes, we have a few presentations you definitely will want to be here for. At 7 p.m., Jennifer Manley from Yana Connection will talk about the empowering families who are in the midst of substance abuse disorders and challenges. She has some great ideas for all families to share with us. And we'll also hear from the Joko Angels. If you haven't crossed paths with the Joko Angels, you'll want to stick around for this presentation. They're a volunteer organization that has done a lot of amazing fight in the opioid awareness and support in Johnson County. Sit back and enjoy this presentation. But now, another couple great speakers. Shelley Wiseman from the O'Neill Institute at Georgetown Law Center, and Regina LaBelle, also from the O'Neill Institute at Georgetown Law Center. We're going to introduce these two ladies to speak to us on a few different things. Shelley is the project director of the Addiction and Public Policy Initiative, and she'll be talking with us about the impact that providing access to treatment for incarcerated people has in addressing the overdose crisis. She'll be joined by Regina LaBelle, who is a director and a Master of Science in Addiction Policy and Practice. Regina will share 5 actions that policymakers can take right now to improve outcomes for people affected by substance abuse disorder. We'll also welcome your questions and feedback in the chat room, so please plan to join the discussion. Now, please welcome Shelley Wiseman and Regina LaBelle.
All right, and I'll be.
Hi there, I'm Regina LaBelle. Thanks so much for joining us tonight. As was said at the introduction, Shelley and I are currently at Georgetown University Law Center, where we're at the O'Neill Institute. We do policy research there. And we also teach and I direct in the new Master of Science in Addiction Policy and Practice at Georgetown University Graduate School of Arts and Sciences. Shelley and I also come to this work from experience in both the federal government and the state government. I worked at the Office of National Drug Control Policy as the Chief of Staff in the Obama administration. And then I also served as the acting director of the Office of National Drug Control Policy last year in the Biden administration. So we're really glad to be here today and thank Ms. Krieger for that heartfelt message about the importance of awareness around accidental deaths involving fentanyl in this country. So I'm going to start. We have some slides I'm going to share first, and I will go over a little bit to tell you a little bit more about what we do at the O'Neill Institute. And also so at the O'Neill Institute, as I said, we do public health research. The institute itself is a global health institute. And Shelley and I work along with several other folks on policy efforts that will advance a public health approach to substance use disorder. We focus on several areas, including the Americans with Disabilities Act, recovery policies, recovery supports, and building policy capacity so that our policies are driven by science and evidence, as well as being rooted in compassion. And that brings us to the second slide, which is our Master of Science program. And I want to just briefly talk about this program. It started 2 years ago at Georgetown. We graduated our first class. And we started this program, we were really supported by Georgetown to start this program because it builds a cadre of policy professionals who are not only committed to addiction policy, but also have the background in science and evidence and policymaking so that when they leave our program, they can hit the ground running and start to affect change. We have our second class right now. They are doing great things in this 30-credit one-year program. All of our students from the first year are already working in addiction policy. So that's another part of the work that we do. So what I want to talk about here is, briefly, what really are the most effective evidence-based policies that can be implemented. And we're going to talk a little bit about harm reduction, but we also want to talk about, where we are today. How did we get here? And what are our opportunities for reform? So as was noted previously, we're at historic overdose death rates in this country. And this is the latest data that was reported as of April 2022. It showed that there are over 100,000 overdose deaths in this country, and that's probably an underreport. And here are the national trends from October 2020 to October 2021. And as you can see, overdose deaths are up nationwide. Now, as was said, illicitly manufactured fentanyl is throughout the drug supply, and we are seeing an increasing supply of pressed counterfeit pills, pressed pills that are fentanyl that may be stamped as Xanax. We saw a lot of those last year coming across the southwest border in Arizona and other parts of the Southwest. And those are spreading and increasingly available across the country. But really what's driving our overdose death rate right now is illicitly manufactured fentanyl, which is involved in the vast majority of overdose deaths in this country. So I want to talk briefly about how we got here. Because as you could see, when I started at the Office of National Drug Control Policy, I started there in 2010. And we were at about 20,000 overdose deaths. And at the time, it was startling to tell people. And now we tell people we're at 100,000 overdose deaths. And we have made strides in that during that time, but really not enough, not fast enough. So what are the most effective steps that we can take? Sorry, I'm going the wrong way. And one of the other areas that we're seeing is increasing racial disparity in overdose deaths. So overdose deaths are across the board up, but they're affecting certain communities more. We've seen, as you can see from the slide, Black communities, Hispanic communities, Alaska Natives and American Indians. Those overdose deaths have gone up exponentially more than the rest of the populations over the last couple of years. Now, one point that Ms. Krieger raised is really important, and we need to keep this in mind as we're talking about our drug policies. So we were fortunate that over the last couple of years, we had the lowest rate of substance use among adolescents. And this is from the Monitoring the Future survey. And we've seen a little bit of an increase in more recent data that's come out. The lowest rate ever, alcohol, tobacco, cannabis. Those are the three drugs that most young people use. But this is the startling fact. At the same time, we saw this huge increase in overdose deaths in that same population. And so it does show what is important is that now this is not the majority of people who are overdosing, but it does show that we need the overall approach to substance use disorder also needs to address this issue. And I'm sure you're going to talk more about this, talking to your kids, making sure they're aware that that pressed pill that they get may have fentanyl in it, the importance of fentanyl test strips, and that everyone who has suffered an overdose that is a great loss, a vital loss. And so we have to have different strategies for different strata. And this is also just the number of fentanyl pills that we're seeing that were seized. It's another phenomenon that we've been seeing in the last couple of years. So when I served in the Biden administration, these were our priorities. We issued this in 2010. It's really about, expanding access to evidence-based treatment, advancing racial equity in how we approach our drug policies, enhancing harm reduction programs. And that means syringe services programs, expanding naloxone access, expanding fentanyl test strips. All of those things help reduce the harms associated with drug use and help people improve their lives, get treatment when they need it. Next is prevention efforts, really important, evidence-based efforts. This is a vitally important piece of it, has to do with parent education, talking to your kids, making sure we're addressing those social determinants of addiction that all too often, poverty, education, housing, all those things all play a role in preventing youth substance use. And then also expanding access to recovery support services, recovery-ready workplaces. All of these things are part of a holistic approach. So we have these policy opportunities, and these are the tools. Often when we think of policies and policy making and changing policies, we think just legislation. Legislation is important, but there are also these other ways we can drive policy change. Regulations can be revised with or without legislation, and sometimes policies can be changed by themselves. You could have guidance in a policy, you could have guidance in a grant that can be revised. Legislative action. Now, I'm a strong believer that for legislation to make a difference, it needs to be bipartisan so it withstands the test of time. And you also have to have an agency consensus. Do agencies at the Office of National Drug Control Policy in the White House, we had to work across the agencies with Department of Justice, with the Health and Human Services Department to make sure there was an agency consensus on the way forward. And then also enforcement actions, Department of Justice taking enforcement actions and enforcing parity. This is done through the Department of Labor, but it's also making sure that your state insurance commissioners are enforcing public insurance parity laws. So we also know that medications for opioid use disorder should never be withheld from people. Withholding them is denying them needed medical care. This is from the National Academies of Sciences, Engineering, and Medicine, which is a consensus report that came out 3 years ago. Now, this was a significant, important consensus report that has helped drive policies, some of the policies that Shelley's going to talk about next. And I'm going to transition to Shelley. We work quite a bit at the O'Neill Institute on expanding treatment in correctional systems, both before people get into the correctional system and upon reentry. And one of the reasons we do that is because one of the greatest groups at risk for overdose are people upon reentry when they're leaving corrections. So this is an opportunity to get people who are incarcerated, who may have a substance use disorder, an opioid use disorder, to get them the type of treatment that they need to prevent overdose deaths from occurring. And we know that this works because we've seen the research on this from the state of Rhode Island, for example. So with that, I'll turn it to Shelley to talk a little bit more about this. Thanks, Shelley.
Thanks, Regina, and it's a pleasure to join you all here this evening. I'm Shelley Wiseman. I'm an attorney and an adjunct professor at Georgetown University, teaching both in the law school and in the Masters of Addiction Policy and Practice program. I'm a former policymaker. I worked in the governor's office in New York, where I oversaw New York's policy and operations for substance use disorder, mental health, and disabilities. I'm also a person in long-term recovery. I was a young person struggling with substance use, and I was fortunate to have access to wraparound services and supports, treatment, including mental health treatment, peer support, and a range of recovery supports. Everybody deserves the access to the services that I received and that many of us have received, so we can all live and thrive in recovery. I'm going to drill down on a few focused opportunities for policy reform. The first is a targeted strategy focused on people who are involved in the criminal legal system. The other is opportunities for reform using opioid litigation settlement funds. First, for those involved in the criminal legal system, as Regina just mentioned, these are folks who are among the highest risk of death, particularly overdose following release from incarceration, but also during incarceration, and in particular during the first few days of incarceration. I'm going to discuss some research related to deaths in jail custody and ways to prevent those deaths through meaningful access to care and treatment. It's a heavy topic, as we're talking about some startling statistics, some of which you see here. And we never lose sight of the fact that we're talking about real people, real lives lost. And we do this work every day with these individuals and their families in mind, so we can prevent more needless deaths. We also keep in mind, as Regina mentioned, that there are significant racial disparities in this country related to who gets offered treatment and who goes to jail for substance use. Despite all of this, there is hope. There is some incredible work going on across the country in jails and prisons, and to support people upon reentry from correctional settings. There are also a increasing array of legal tools, policy strategies, and of course, clinical strategies to address and prevent these incidents from occurring. So as we saw on the previous slide, there is an agency that lives at the Department of Justice that is called the Bureau of Justice Statistics, and they've been tracking deaths in jail custody since at least the year 2000. We really have a picture over the last 20 years about the number of deaths in jail custody and the cause of death. And what we're seeing is a significant increase in deaths in local jails. That's what we're talking about here, county jails primarily, cities as well, due to drug and alcohol intoxication. So just from 2017 to 2018, so that's the most recent data available, 2018 and 2019, there was a 19% increase in deaths due to drug and alcohol intoxication. And overall, since the year 2000, the number of deaths in local jails from this cause has more than quadrupled. As Regina already mentioned, upon reentry, people are between 10 and 40 times more likely to die of an opioid-involved overdose than the general population, particularly within the first few weeks after release. And even where folks don't experience the kind of this mortality, there are significant collateral consequences of incarceration and justice system involvement. So because of these reasons, this is why a targeted strategy focused on increasing access to treatment in correctional settings, and then of course keeping people out of the correctional system entirely, is a strategy that does reduce overdose deaths. We at Georgetown recently conducted some original research where we looked at all of the cases, lawsuits involving a death in jail custody over a 5-year period of time. So from 2015 to 2020. So for the most part, this did not include anything related to COVID. And over that 5-year period, what we found is over $256 million was awarded to families that had lost a loved one. And of course, this is an undercount. We were able to look at cases and settlements that were reported, but there are many settlements that go unreported. So what we found, which is similar to what the Bureau of Justice Statistics has found as well, is that suicide is the leading cause of death, accounting for claims in 35% of the cases we reviewed. A quarter of in-custody deaths occurred within the first 36 hours after arrest, and many of those cases were drug-related. So I'm going to reiterate this. A quarter, so 25% of the people that died in custody in the cases that we reviewed, which was approximately 800 cases, those deaths occurred in the first 36 hours that person was in jail. So when we think about a targeted strategy, and like I said, many of those were related to overdose and withdrawal. So a targeted strategy about jails, really one of the focuses has to be in the first few days somebody comes into custody. And this number here, kind of going to go back related to deaths by suicide. When we dug into these cases, what we saw is that many of these cases, I think it was about 20% of the suicide related cases, also involved drug or alcohol, whether it was intoxication, withdrawal, symptoms of withdrawal, history, or otherwise. So there's a lot of overlap here. Drug-related deaths on their own accounted for 19% of the lawsuits filed, and jails paid out since 2015, or in that 5-year period of time, over $84 million in lawsuits related to those substance-related deaths. So what we see from this data is not only has there been a significant increase in substance-related deaths, there also, and this is something that the Bureau of Justice Statistics reported, there's an increase in deaths overall from all causes. And many of those deaths, the suicide-related deaths, deaths related to excessive use of force by correctional staff, many of those were also related to substance use or withdrawal. So these are startling statistics. And what we saw is that, many of the cases we reviewed in our study did involve deaths in custody, but there were also many cases that were settled out of court. And there's been a movement over the past few years to address these issues before death occurs, particularly in the context of people with opioid use disorder. These are cases which request injunctive relief before a person enters jail or prison. So essentially, this is somebody who is currently in recovery, receiving medication for their substance use disorder, methadone or buprenorphine usually, and they know that they're going to go to jail for an offense. And they know that that jail may not offer them methadone or buprenorphine. So in those cases, they ask a court of law to step in and require the jail to provide them with their medication. And in many of these cases, what we're seeing is a trend growing across the country where the judge orders the injunctive relief. A number of these cases have also settled out of court. Some of them have been class actions. And some of these settlements require the jail to provide these medications to every incarcerated person in the facility that needs them. So we're seeing these cases really spurring reforms in jail across the country. Sometimes this type of litigation has spurred statewide action, either through legislation or executive orders, which require jails and or prisons in the state to provide certain treatment and medications, and through funding. So federal funding and state funding, we're seeing a real kind of increase over the last few years of targeted funding for this purpose. And what jails are seeing that are starting to implement this is not only does the rate of overdose and morbidity and mortality reduce, people stop coming back to jail. The sheriffs and jail administrators that have implemented this, we have one jail that we speak with in Albany County, New York, and the sheriff there in Albany County calls providing these medications a no-brainer. What he saw was people just stopped coming in and out of jail. He had to decommission 100 jail cells in the county because it was the same people coming back over and over again. But when they got treatment, they stopped coming back. And what we're seeing also is in recent years, at least 31 states have issued executive orders, taken administrative action, or established policies governing treatment for substance use disorders during incarceration. And at least 24 bills concerning access to medications for opioid use disorder in jails and prisons have been enacted across 18 states. So there's a real trend here. And what you're seeing here, the top is just is a news article about this. Then you have our model state law that we developed on this issue. It's on our website, and a 50-state snapshot that talks about the policies that have been developed across all 50 states. So we can go to the next slide, and I'm going to just touch briefly on the opioid litigation settlements. This is, just some more. And then I think I'll stop in a couple of minutes. I'll just go through these quickly so we can take questions. So just briefly, another kind of key opportunity to address the overdose crisis is the settlement funds that are starting to flow already. A very large case was just settled, referred to as the master settlement or global settlement. And not every state signed on to this settlement, but many did. And how that money is going to flow looks different in different states. There are agreements between the state and the counties, which were the plaintiffs in this case, about how the money is going to be divided up. And in some states, like in North Carolina, for example, upwards of 85% of the funding is going to the counties. So it's important to think about when folks are engaged in advocacy, where to direct advocacy. In a state like North Carolina, that advocacy is, directed towards the counties. That's where 85% of the funding is. And, these are just some lessons learned from the tobacco settlement on this slide, that a small percentage went to actually abate the issue and for public health strategies. So let's keep moving. I think we have a lot of information on our website about strategies for addressing and using this funding for evidence-based treatment. So I think, we'll share that information For lack of time, I'm not going to go through all of these. But we also have developed a model state law that focuses on ensuring that the funding goes not only to support evidence-based treatment, prevention, harm reduction, and recovery, but that it makes sure that the funding is going to supplement existing funding rather than supplanting it. So that means that this money doesn't just replace money that would have otherwise been spent, that it actually is new money in place in addition to what a state might have otherwise spent to address the overdose crisis. Couple of highlights for the way forward there, but we're almost out of time. And of course, on the next slide, that we don't forget that these are our people that we're losing every day, and that's why we fight this fight. So thank you, and we'll take questions. Regina, do you want to take that one?
The question was, how do you effectively use a test strip on a pill without destroying the pill? So I think that would depend on the test strip that you're using, but you can wet it. I mean, it's kind of an off-label use. So, but I think it depends on what you're using. But I hear what you're saying, because some people drop it in water and that destroys the pill, but you can, in some cases you can just wet it. All right.
Thank you.
Thank you. Bye-bye.
Thank you, Shelley and Regina, and thank you for all you do to put these policies in place and continue to change the curve of opioid use here in our country. We thank you all for joining us tonight too and watching this presentation and being part of this summit. In a little less than an hour, we'll be joined by motivational speaker and multimedia executive Nina Bosky, who will talk with us about how to take your life from tragedy to triumph. A very powerful message. So please stay tuned and stay with us for that presentation. Now at this time, I'm very pleased to introduce Jennifer Manili from the Yana Connection. Jennifer is an incredibly talented, inspirational artist who uses her talents and motivation to help people who are in the midst of substance use disorder challenges. She has some great ideas to help people using creativity and encouragement to work through their difficulties they are facing. Jennifer, welcome.
Thank you so much for the introduction. I actually have to start with a little bit of a disclaimer. I am absolutely going to be talking a lot about my own mother, and some of it will start sounding like I'm talking bad, and you're like, who could talk about their mother like that? But this talk is about empowering families. Let's change the conversation. And what's been great is that my own mom and I have been able to really work through a whole lot of stuff. So even before this talk, I was talking with her. I was like, Mom, I'm going to go give this talk, and I'm a little nervous, and I'm not entirely sure what to do. And so we talked to her. She's like, oh, you need to tell this story for when I did this, and you need to tell this story when I did that. So she knows exactly what I'm getting ready to talk about. Now, here's the other disclaimer. The camera is right here, and I'm going to try to talk to it, and there's people behind me, and I'm always going to try to also talk to people. So if you see me looking off to the side, it's because I'm talking to the people that you can't see. So, anyway, I want to start with saying that I grew up with a mother who was a very, how do I say this, intimidating woman. She was scary. She worked at a very large bank in a very high-profile job, and they called her the bank bitch. Yes, I will be cussing, by the way, a little bit, not too much, just a little bit. And I was always so terrified of her because she would like rage out in the house. She would go absolutely crazy. So I was scared of her. I think the whole world was a little scared of my mom. She was that typical mom that would swoop in if there was a problem and just take over and solve all the problems and just, you know, get in there and this is what we're going to do and start commanding everyone, and everyone would come to attention, and that was my life. And so it was really interesting in that moment in which I had to go to rehab the first time. I say the first time because there was more than one time. And so when I went to rehab the first time, none of us knew what we were doing. I didn't know anything about recovery. I didn't really know anything about substances other than to generally know how to do them. But in terms of the help that was out there, I had no idea. My mom knew even less. She knew less of what was going on with me because I'm not going to sit there and tell my mom what I was doing behind the scenes, mostly because I was scared to death of what she would do to me and say. So I remember the day that I told her I needed help. She and my stepdad got into the car in a snowstorm and drove through the snowstorm to come rescue me, because that's what you do. And that's exactly what I needed at the time. And I remember she told me this story later. She goes, yeah, I called the rehab and I got on the phone and I said, I would like to book my daughter a room into your rehab. Thank you very much. And the guy on the other end of the line, he goes, well, aren't you just a good little mother? It kind of took my mom a little off guard because she's not used to having people speak to her like that. And in that very moment, she says she sat on the bed and she was like, what? For her, that could have gone very bad for some moms. For her, it was exactly what kind of pierced through that commanding, that intimidating, that let's get something done. And she was like, what do you mean? And he started going off. Now later, I met this individual that had left my mom speechless, which, if you know my mom, that's not very easy to do. And he was a crass son of a bitch, I'll tell you what. And he was exactly what my mom needed because he was real. He put her in her place and reminded her that this was my journey. And it forced her to do something different. And within that conversation that she had with this guy, she realized all of what she didn't know. And she had to go start figuring out how to do something different. And that took a little bit of work on her part. And on my part, it took a whole lot more work. So I entered into this rehab facility not knowing at all what was happening, what was going on, did I even belong there or anything like that. So I'm going to fast forward a little bit because I don't want to go into, my entire life story, but there was so many come to Jesus moments, I guess, for us, and the questions. And I remember there were so many moments that we had together where she had to start working at separating herself for me because my whole life, all she did, not all she did, but if there was a problem in my life, she was going to jump in and she was going to solve it. And part of me, because that was what I grew up with, loved that. So when I had a problem in a city and things got bad enough, she would swoop in and she goes, all right, you know what? You just need to get away from those people. You need to get away from everything that's going on there. You just need a fresh start. And she would help me pack everything up, and she would pay to move me into different places. And I would get all of these new fresh starts, and I felt so loved by my mom because that was for her the way that she showed love, was to come in and solve my problems. And in that moment, when she would do that, yes, there was the love, but what I didn't realize until much later was every time she did that, subconsciously what it taught me was that I couldn't do it for myself, that I was always going to need her or someone else to take care of all of my problems. And I didn't even start really noticing that until she took a step back and started allowing me to solve some of my problems. And it didn't mean that my mom wasn't there for me. She's been there for me every step of the way, but there were times where she had to step back and let me figure out what was I going to do about the problem that was right in front of me. And I had to learn this skill because that was her role my whole life. She was the one that did that. I didn't know how to solve my own problems. So she would do that. Now she had to learn how to step back. It was a very challenging time for both of us when she started figuring out that it was time for her to be there for me, but also allow me, I guess, to adult in this world. And a lot of things came up for her, and it wasn't perfect on either one of our parts. And what I love about our journey is that we have both had our separate journeys through our own situations, and we've also been able to have our journey together. And now we use all these stories that we have of where things both worked and where we realize that there may be a different solution in front of us as well. So again, fast forward a little bit, and I got into recovery again, and I started doing really well. I went back to school, and this was the other thing that was a really challenging time period, was in those first initial stages of recovery, because what my mom really wanted was for me just to kind of continue on with the life that she dreamt for me, which means that as soon as I finished rehab and I just kind of got a little, my I guess feet a little wet, she was like, you need to go back to school, you need to do this, you need to do that, you need to move on with your life. And that was a really challenging period for us, because it was like, I don't know how to life. I don't know what I'm doing. I am literally trying to wake up and remember to take a shower and brush my teeth, much less try to go to college and do all of these really scary things. I'm just trying to figure out how to show up for work. I don't even know how to interview. Like, where I ended up going with my substance use was that in the beginning, it had messed up my chemicals in my brain so much that I had a very difficult time, like, completing sentences. So people would talk to me, but they couldn't really talk to me because I couldn't communicate. I thought I was communicating, but later they tell me, they're like, you didn't make any sense. Because I couldn't form sentences, much less, like, think about what was I going to do for the rest of my life. And that was something that when I think back, this is a very common question that like a lot of families, like I come from a really good family, so I go home at Christmas and everyone would sit down and they'd have their little chat with me, like all my aunts and uncles, and they'd be like, okay, so now what you gonna do? What are you doing for the rest of your life? I'm like, I have no clue. I'm still, this would even be like a year later, I was like, I'm still just trying to figure out if this is the life that I'm gonna have, because at one point I just knew that my life was over, and now I'm here and I don't even believe that I'm here, because I thought I was gonna die and I don't even know if I can do this. And this would be like a year later after my recovery, or getting into recovery. I'm still going, I don't know how to do this. Eventually I did. And I did go and go back to college, and I did all of those things to the point where, and this is where I really want to start talking about what it looks like to empower families. I was actually working with my mom, if you can believe it. So at some point we had done so much healing that we were actually able to work together. And one of the things that she does is, she is a corporate executive leadership coach. So she works with a lot of high power executives. So a lot of like the people that she was when I was growing up. So the ones that are very commanding, the ones that are like, I'm gonna go send, my kid to the best rehabs and spend the most money, and they're gonna fix my kid, and they're gonna do all of these things, and those are the ones that I'll call up to the rehabs and check on them every day, and hey, I need you to make sure they know to do this, and I need you to make sure all of those things, right? And that was exactly how my mom was. So we would be working with these executives, and a lot of the ones that had some of the bigger challenges were the ones that were hiding in secret with what was going on in their life, which was they had a loved one that they knew that their kid was, and I say kid, but I mean adult child. So this is like the 30-year-old that just can't seem to get their life, and the parent is sitting here going, what did I do wrong? This is not what I wanted for my kid. This isn't how I saw this happening. They were supposed to be in medical school, and instead somehow they're smoking crack. I don't understand what happened. Where did I go wrong? And that's one of the things that I, especially in this talk, want to make very clear is that nothing, families did nothing. It's all of the internal stuff that comes up. And this is where I feel like it's really important to start looking and empower the families to start understanding that it has nothing to do with them, has everything to do with their loved one, but how can we support them? How can we love them? How can we change that conversation? Not only are they having with their loved one, but with themselves. Because when I start talking to these parents, there's so much shame, there's so much guilt. One of the first places, this was interesting, one of the first places when I'm working with a family member that we go into is the most dreaded question that they get when they meet someone or they see someone they know on the street. So how's Jane Doe? They hate that question when they have their kid that's out there smoking crack or doing heroin or fentanyl or whatever it is, partially because they take a lot of responsibility for that and they don't want to tell people what is happening because of the stigma that is around that. And I think it's really important that we also really start looking at some of the stigma that we have around this substance abuse community and how do we language it? How are we talking about it? I think in the community where we have a really clear understanding and we're really great, it's the outside, it's the parents. It's the, you know, the fire people, the police, the people on the outside still look at it like there's something wrong or a moral failing or something with these people. And so this is one of the first things that we talk about is how can that question not hit so hard when you think about your loved one and someone asks you how they're doing. How can you approach that conversation in an authentic, honest, and yet not in a place in which brings up all of that shame? How can you still be proud? How can you still say something along the lines of, you know, they're really struggling, but I have so much confidence in them. They are so strong, and I am so excited to see where their journey takes them. Isn't that a different conversation than like, oh, they're just not doing so good? And I think that's a really important thing for the families. One of the things that I started doing, let me check my time here. I'm doing pretty good. One of the things that I started realizing when I was talking to families, they call me up. All these families would be in such a state of like almost like sheer survival mode because they've been living in fear for so long that their loved one was going to die. They wouldn't hear from their loved one, and they were just completely lost, like they couldn't do anything. And that was a really hard place for me to enter into the conversation. So I'd kind of tell them a little bit about, you know, what I do and how I could help them. And generally what I start with is helping them answer all of those questions that they've been holding on to. That's where we start. And when they would start asking these questions and I'd start answering, they were in such a deep place of that survival mode that it was hard to get them to move anywhere. Like, they would say, Jen, I think that what you're doing is great and it's such a need, and I just don't think that I have it in me, because they were so depleted of all of their resources, their emotional resources, their mental resources. Everything they had was just, it was gone. They had nothing left to give because they've been giving it all, and they had no way to, I guess, metaphorically fill their tank up. So when they were coming to me, they couldn't go anywhere. They couldn't do anything. They're like, I can't even deal with this. They would go back into their shell, and then they would still call me, you know, a few months later, and then a few months later, and they'd still be in the same place they were, all because they couldn't make any moves to do something different for themselves. They didn't know how, they didn't have the resources, it was such a struggle. So I sat back and I really spent a lot of time thinking about, what do they really need? How do we start changing this conversation? What do I hope for them for when they call me? Where do I want them to be and where do I want them to go? And I was like, the very first thing is we have to kind of kick them a little bit out of survival mode. And we have to look at starting to satisfy some of their own needs. So then we can even start talking about the conversations that we needed to talk about to get them into a different place, to start looking at, okay, this is how I can show up. This is how I can start managing myself through this. This is how I can start getting some sleep at night. This is how we had to fulfill some of those basic needs again. So I'm like, how do we do this? And I started thinking about, well, we really need to fill their cup. We really need to get them into a more empowered stance, a more like, okay, I have the courage to do this. I have the strength to do this. And in the announcement, they called me an inspirational artist, because that's, I started thinking about it. I was like, I really feel like they need some inspiration in their life. Now for me, when I started thinking about it, I was like, well, I'm not really an artist, but I think if I can just have them move from one place to another inside of themselves, we may be able to do that. How can I get them to do that? What if they started focusing on something different? What if they started focusing on something more positive, and we could have a little bit more balance? And so that's where I started creating some of this artwork. And I had to start from scratch, because I've never been an artist in my life, but I thought this was a really creative way to start bringing something different to the table, to really start changing that conversation and having the conversations that I really wanted to be having with these families out there, that I felt like were crucial, but also understandable that they were painful. So how are we going to balance it all out? So when the artwork, I'm just going to give you a little example. Let me grab it real quick. Hopefully you can see it in the camera. My technician over here is going to say, yes, you can see it, or no, you can't. All right. So this is just one of many of the things that I have put together. And if you notice, this has nothing to do with substance abuse and everything to do with substance abuse. So it says fear has two meanings: forget everything and run, or face everything and rise. What is your choice? And I decided to put that question at the end. This was a very common phrase. I think in the original saying, when I found this, it said the choice is yours. And I tailored it to say, what is your choice? Because I think the question, people have to sit back and start thinking about, what do they want in their life? How do they want to be? And when people look at it, and I would love, because I can't see the chat right now, but eventually I'm going to go back, and I'm hoping can we see the chat later if we go back and look at so he's nodding yes. So I can't see the chat right now, but I want to see the chat later. When you saw that, and when you think about that for yourself, I'd love for you to put in the chat, what came up for you? What does that mean to you? Because it's going to mean something different to me, and it may mean something very different to you. And I'd love to kind of hear some of your insights. What did you think about? What were some of the stories that came up? What did it mean to you? I'd love to go back and read that. So thank you for doing that. When I started doing this, and I have all sorts of different quotes. When I started doing this and putting it out into the community, this is probably one of my favorite stories, because this is how important this stuff is. I was at an art show, and because that's how I kind of go out and I reach the community, and because a lot of times these families, they're in hiding. They're not telling people what's happening with them. They're not looking at the resources that are actually available out there, because they're scared, and partially because they haven't even totally admitted it to themselves that they probably need help with figuring out what's coming up. They're not going and looking. They're very quiet. They're hiding. They don't want people to know. So I was at an art show, and this woman came in. She was very very proper. She's very well dressed, very well maintained. She's looking around, and she's picking through some of the quotes, and she picked something out. She goes, I want to give something to my daughter. She's just really been struggling. And I was like, well, you don't have to tell me, but what has been coming up for your daughter? And the next thing I know, this woman is just telling very openly about what's been going on with her daughter. She had just gotten out of rehab. She had really been struggling and just trying to find herself. And so we had a really great conversation about her daughter. And I was like, oh my gosh, like, you're the person that I'm here for. Because there's usually one. I show up to these events, and it's like I find that one person that I showed up for. And yes, I go out and I sell these paintings, but then I meet that one person and I'm like, you're the one person that I showed up for. And so I told her that, and I gave her my book. It's I'm gonna bring this out here too. So I gave her my book, and I said, I'm just gonna give this to you. And can you see that? Okay, excellent. He's such a good tech guy. And it's called Dear Parent, Strategies to Help Your Loved One Through Addiction. I know that we use SUD now, but this was a few years ago when we were still using the addiction term. Is when I wrote that. But when I didn't think too much about it. She cried, I cried, we hugged, she left, and I didn't think too much about it. I thought about her a little bit. You know, I told my mom about her, and I was like, but I think I scared her off. I don't think I'm ever going to hear from her again. It took about a week and a half. I get this long email, and it was from the lady that I had met at this event. And she said, Jen, I have to tell you that I cannot believe that I ran into you. It was such a godsend that you were there. She goes, up until that day, I had told no one what has been going on in my life. She goes, I have been carrying that around with me for a long time and just feeling the weight and the burden. And it's like when I ran into you, one, I was very overwhelmed, and I wasn't really entirely sure what to do with it, but it was so relieving. She goes, I came home and I told my husband that I had ran into you and that I told you everything that had been happening. And he's like, you did what? And it was such a powerful story, and I was so grateful that she was able to actually start talking about what was going on, because we have to talk about it. We have to talk about what's going on in our lives, because there's nothing to be ashamed of. And that's what I wanted to provide, is a space for people to feel safe, to start talking about the things that's going on with them, and not creating an identity around what's going on. It's just something that's happening in our lives. It's nothing to be ashamed of, and that's really what I wanted to bring to the table with these families, is that let's talk about it. Let's get some of your needs met. Let's also answer some of these big questions you're holding on to. And your life is the quality of your life is going to go exponentially. And most importantly, you're going to be able to show up for your loved one in the way that they need you to show up. Doesn't mean they're always going to be happy about it, but you're going to feel good about it. The parents are going to feel good about it. And eventually, the loved ones, when they do actually get into recovery, are going to be really grateful that those were the moves that you started to make. So that's really what the Yana Connection is. The Yana Connection, it stands for You Are Not Alone. And it's the idea that we're all connected together. And it's creating a community in a safe place where we get to talk about things in a safe way. And that is my whole spiel. So thank you. Thank you. Can you hear me?
Thank you so much, Jennifer. I just love you. Jennifer joined us when we did our Asheville event, and she's one of the family now. So I just want to remind everyone about 2 more days of our People's Opioid Summit coming up, tomorrow and on Saturday. So you can come to the building where we are right now, and that is the American Institute of Health and Fitness in North Raleigh, or you can join us virtually. We'd love you to come in any way you want. Please go to peoplesopioidsummit.com website, and you'll find all the ways that you can register. And tomorrow we start at 9 o'clock and we end at 5:30. And on Saturday we start at 9 and we end at 3. And we look forward to seeing you there. And one more thing, if you're writing in the chat, we are monitoring it, so please feel free to write your questions, a comment. If you want further information, leave us your email so we know who you are, and we will be delighted to communicate with you. So next up, JoCo Angels. And JoCo Angels has been presenting with the People's Opioid Summit each year that we've done that. So we are once again delighted that they are here. They are an inspiring nonprofit organization from Johnston County, and they are focusing on making a huge impact in the fight against substance use disorder. They're an active volunteer group that's making a difference throughout North Carolina, and they have been working with other groups as well to help them in their areas and in their counties, and they are a group of parents. So we're delighted to have them. I'm going to turn over the time to them. Welcome. Thank you.
Okay, good evening, everyone. My name is Kelly Bloss, and I'm the president of JoCo Angels, and I have here with me tonight Danette Jernigan. She's the vice president and public relations officer for JoCo Angels, and we're just honored to be able to join the People's Opioid Summit again this year. Our hope this year is that we are able to inspire other parents, community members, family members into action in their community. We know that substance use disorder has become a major issue in our state, and we are just a grassroots organization. We are faith-based. We believe that God has opened up every door for us, but it's really the passion that is for people who are dealing with substance abuse disorder, who have lost someone, that has opened up so many opportunities for us to work in our community. So we're going to get started. We want to share a video that kind of just explains who we are and what we do, and then we'll go into some details about us and some of the work we've been doing.
My name is Danette Jernigan. I volunteer with JoCo Angels Opioid Awareness and Peer Support Group, and we are based in Johnston County. This group was established by two mothers that lost their children to opioids, and we provide services in the community for peer support for those struggling with addiction, grief support to families that have lost loved ones, parents of addicted loved ones meetings, parents that are currently struggling with an addicted child or loved one, and we also do outreach and education in the community and the school system in Johnston County. We try to partner with as many agencies as possible in our community. We enjoy the partnership that we have with the Heroin Education Action Team offered by the U.S. Attorney's Office. We do go into schools and do presentations and bring in law enforcement officers with that partnership, as well as grief counselors and other family members that have lost a loved one. It helps to educate our youth on the dangers of drugs and the consequences if they take that path. JoCo Angels is all about community. It's all about helping those in need and giving back into our community and our children. I think that we are a unique group of people because we all come from different backgrounds and we all have full-time jobs, and we still find the time to do the advocacy work that we're doing. We still find the time to go out and do peer support for those that are struggling with addiction. In the things that we do, it's so hard for people to understand this journey unless you've walked it yourself. And sometimes it's hard to go through the things, with these individuals that are suffering, because it brings back our hurts as well. But there is a beauty in that. It's just an unusual connection that you have with others that have lost their children to addiction. Dakota was a very fun-loving person. She loved to joke around and play practical jokes on people. That's one of the things that I miss the most probably about her. If you saw her smile, you would just be, brought into her with her humor. She was very intelligent. She was actually in school for radiology in college. She was hardworking. She had a job since she was 15 years old. And that's why her addiction really surprised me. It was just a complete shock whenever I found out that she had started using drugs. And she hid it very well. For the longest time, we didn't even realize anything was going on with her until I started noticing some little personality changes. That bright, happy face with a beautiful smile turned into a blank face with no personality, very angry, aggressive, sad. And that's when I knew that something was not just right. That she told us from that one Xanax that it made her numb and it made her forget about her problems, and she loved it. And that progressed to pain pills, which then progressed to heroin. And I lost her to fentanyl poisoning at the age of 22 back in May of 2019. My advice to other parents would be present with your children. Pay attention to what they're doing, pay attention to their behaviors, and if you do notice that personality change, talk with them. Sometimes it's difficult to have those hard and holy conversations, but it's better to have those conversations and be wrong with whatever your instincts are telling you than to avoid having those conversations and something truly be going on with your child. And what I have learned since losing Dakota was there is a way to love your child without enabling them. And it's taken me 2.5 years to understand that. But that is what I try to tell parents now. Find your line and know that you can love your child without enabling them. And never say anything that you can't take back or that you can't live with if they're not here another day.
Okay, thank you. I am going to, at this point, turn the presentation over to Danette. I'm going to move on to her first slide. Welcome, Danette, and she'll talk about some of our work with the local schools.
Thanks, Kelly. Currently, we're working with 5 schools within Johnston and Wayne counties to do drug awareness presentations or some type of Red Ribbon Week campaign. In November, we've actually invited the Heroin Education Action Team to join us. They're from the U.S. Attorney's Office, and we'll be doing a presentation in November for one of the middle schools here for 6th, 7th, and 8th grade. So we have 3 different programs designed for age appropriate with resources and speakers for that. We do have college student volunteers that have been a big asset for us since last year. And they've worked with Johnston County schools that were interested in doing competitions for Red Ribbon Week this year. And that's, as everyone knows, it's in the end of October. So the schools had a choice to either do a TikTok challenge or do poster contest. And the winning homeroom will get a pizza party. The second runner-up gets an ice cream party. So we're always trying to figure out fun and unique ways to engage the middle and high schoolers while we're also providing the life-saving information that they need. Any other ways that we can get out into the community, we try to do that. Most recently, actually this week, we were at Hope Extended speaking to their teen recovery group called The Landing. We had a presentation there that included speakers from our team, as well as two gentlemen that are residents of Hope Center Ministries, which is a long-term recovery program, and one of our college interns. And he did a brief CPR instruction with those teens and talked about overdose and what to do in those situations. And we did similar format with the Boy Scouts recently. So we're always looking for any church, youth groups, civic organizations, or anywhere we can go to speak and share this information. That's what we enjoy doing. We also travel to other locations. It doesn't have to be just in Johnston County. As long as our schedule permits and we have enough staff members or volunteers rather to do that, then we're happy to go anywhere that we can in order to get these messages out. Next slide, please. We also provide one-on-one addiction support. Our volunteers typically will get phone calls from people that are seeking recovery, or they may be in long-term recovery but having a difficult moment and they just need some support with that and some encouragement. So we do provide one-on-one addiction support, and we assist in finding placement for people that are trying to find their recovery. We do partner with Hope Center Ministries, which is a 12-month faith-based recovery program. It's in the one we partner with is in Wayne County. And I think Kelly will probably talk more about that later on. But once the men and women enter the program, we support them in any way that we can, and not just ones that we sponsor to go there, but also any of the residents that may be there. We provide meals to them around the holidays. Last year, we spent Thanksgiving and Christmas with them, just being there to support them while they're not always able to be with their family members. We attend other functions that the residents may have. And we also provide them with volunteer opportunities with JoCo Angels so that they can feel like they're giving back to the community while working their recovery. Next slide, please. The reason I became a member with JoCo Angels is for the grief support, actually. I met Kelly one day after I lost my daughter Dakota. About 3 weeks later, I messaged Kelly, and I just realized how important it was to have someone that was walking my same path to understand what I was going through and how I was feeling when other people didn't necessarily know that. And so immediately I knew this was something that I would want to do. And so we do grief support for families or anyone that has lost a loved one. And we'll meet them at a restaurant or go to their house. We'll have coffee and just talk with them and basically allow them a safe space and safe environment to share anything that they may be going through, and just kind of walk with them so they don't feel like they're alone in their grief journey. Also, we know that we can grieve the living. And so in people that struggle with substance use disorder, oftentimes we find ourselves grieving for our loved ones and they haven't passed away. I know I went through a period of time with that with my daughter. And so we do have people that have been trained to help facilitate another support group that Kelly's going to talk about in those situations as well.
Before we move on, I just wanted to see if there's any questions for Danette. Or Danette, did you have anything else you wanted to say about that?
No, I'm happy to answer any questions if people have anything. They can always reach us too on our resources, jocoangels.com or our Facebook page. But again, our passion is to get out and help those struggling with substance use disorder, as well as grieving families, friends, helping people find recovery. So we're always here and available and happy to help.
Thank you, Jeanette.
Thank you.
One of the programs that we're most proud of and that we would love to see expanded in North Carolina is Parents of Addicted Loved Ones. This is a nationwide support group. Many of you may have heard of them, but not every town has them available. So when we first started JoCo Angels, we had a group of ladies that would get together on one night a week and go into Raleigh to go to a support group that was held at Healing Transitions. And when we found out about Parents of Addicted Loved Ones, we had 3 of our JoCo Angels members become facilitators for Parents of Addicted Loved Ones, and that's free. The program offers those online trainings for free. It's about 9 hours of training, virtual training, and you can do it at your own pace. But they provide the curriculum for Parents of Addicted Loved Ones and all of the materials that you would need as far as signage, support. They support you so well. The whole organization does. But what we found is that so many families, when they're dealing with substance use disorder of their children or their family members, they feel totally alone, and they're ashamed and they're embarrassed to reach out to people, sometimes even in their church. And so when they walk into Parents of Addicted Loved Ones, almost always the very first time they visit, they spend that entire time crying, and they share their story, and they're just so overwhelmed that they're surrounded by people who know exactly what they're going through. The requirement to become a facilitator of Parents of Addicted Loved Ones is to have a child or a person in your family, I think core family, that is or has been in addiction. They can be in recovery. You must be 18 or older to attend those meetings, and people that are experiencing substance use disorder are not able to attend that meeting. So it's just for the person that's struggling with someone who's addicted, and so they're very protective, and it's just a wonderful group. And so, like I said, if you're interested in starting one in your community, I would strongly recommend going to palgroup.org. This has just been one of the most powerful resources, and I'll just tell a quick story that happened to us through Parents of Addicted Loved Ones. And it's not a happy story, but it does tell you the power behind gathering together. So when we started our group, we had a gentleman come in, and he began to work the process. Like I said, every week there's an educational component, and it teaches people how to deal with situations with substance use disorder, such as enabling or overprotecting. And so this gentleman every week would come in, and he was learning and trying and doing everything he could. And after attending with us for about a year and becoming very close to us, his son passed away from an overdose. And so he called my husband right away, because we were facilitators, and told him the morning that he found his son. But he always speaks about Parents of Addicted Loved Ones because he feels like God was preparing his heart for the day that was going to happen to him. And then he knew that he had a group of people who had already experienced the loss of a child through substance use disorder right there around him. And so we were able to surround him, and he was already in the place where he needed to be in order to go through the next step of this grieving process of losing his son. And it was just, it just really showed us that there was such a need for this, and why both groups interacting together was so important. As Danette mentioned earlier, we partner very strongly with Hope Center Ministries. We feel like this program, we've watched it change people's lives. It is a faith-based program. We offer scholarships in honor of our children that we've lost, any of our JoCo Angels that we've lost. We do scholarships to Hope Center Ministries for those who choose this as their program. It is a 12-month program. It has 3 phases, including a vocational training phase, where the residents go through working a 40-hour week, getting life skills. They get to go to some of the community college classes so that they're more prepared at the time when they get to phase 3 and exit the program, graduate the program. They have some life skills in place and some work in place. And for us, especially those of us that have lost children, being able to volunteer and mentor at these houses and walk beside someone who's struggling has helped us tremendously with our own grief. So definitely one of the programs that we support. With JoCo Angels, we don't necessarily support one path to recovery. We get calls all the time from people, and sometimes the first thing they say is, I'm not going faith-based. And okay, so we will find another resource. Sometimes they want medicated assisted treatment. We're fine with that. We will look for a resource for them. The most important thing for us is to keep them alive, whatever it takes. I dealt with a young man last month who called me and said that he was a daily fentanyl user. He wanted to go into detox, but he needed to wait until Friday because he needed to pay his rent. And so Danette and I called each other. We tried to make sure that the young man had Narcan for the rest of the week, and gave it to his wife and said, I know you're going to, it's only Tuesday now. I know you're going to be using till Friday. We did get him into a detox center, but he wasn't leaving. And so I said, I want you to survive until you walk through the door of that detox. And praise God we did, because he did go to detox on Friday, but he checked himself out on Saturday. And when he was driving home, he stopped and got him some fentanyl, and he overdosed on his front porch walking into the door. And his wife was able to Narcan him and call EMS. And when the EMS got there, they told her that he would have died had he not had that Narcan. So, like I said, we support multiple paths to recovery. I will say that the gentleman is doing good. He has more than 30 days clean now. That scared him really bad, and so he's doing really well. But we'll help in whatever way we possibly can to get someone off of the drugs and on the right path, whatever method they choose. We were able to join our Johnston County Opioid Task Force. Like Danette said earlier, we don't now just work in Johnston County. That's where we started our organization. But now we also include Wayne County, Cumberland County, Wake County, Harnett, Sampson, and Moore County was just added. But initially we joined the Johnston County Opioid Task Force, and they recently invited us to share how we felt the opioid settlement funds should be spent in Johnston County. And some of the needs that we see that are really, really strong is free and low cost detox for uninsured. We go through Port in Greenville. We also take people to what's called Roxy. I think it's RI International. Is that right, Danette? You have to remind me.
Yes.
Okay, so there's 3 in North that I know of nearby. So I think there's one in Durham, there's one in Fayetteville, and I think one down in Wilmington. But so we use those detoxes, but as you can see, there's not one in Johnston County. There's not one right here in Wayne County where we can easily take someone who needs detox right away. We like the Port Greenville model because one, they do offer medicated assisted treatment. They allow medicine for folks that are coming off and just to help them through that. I know that Roxy also does that. We would be happy to see any detox in our immediate area. We also need more local rehabilitation options for uninsured, long-term halfway houses and faith-based. There's just not enough room. And right now there's 3 Hope Center houses, 2 for men, 1 for women, and they are constantly filling up quickly. So we need to see more options. They don't, like I said, they could be multiple ways. One of the biggest things that I've seen is that we do not have enough mental health resources in our immediate area. And as we all know, mental health issues often go hand in hand with addiction. And I know for myself and my own experience with my son, just being able to make him an appointment to see a counselor, particularly one that has experience in substance use disorder, has been a nightmare, and it's almost impossible at times. They're just, especially during COVID, they didn't have anybody available to see him, and so we struggle with that. And so hopefully we can see some programs out there that would promote education in mental health and allow us to get some more mental health resources in the area. And always we feel like it's important that there's stronger options for medicated assisted treatment, whether that's Suboxone, methadone, Vivitrol, the monthly shots. We need to make that more widely available for people who choose that option, whether or not they have insurance or Medicaid. And again, a Narcan training and crisis services for schools and EMS, police, fire department. We need more Narcan. We struggled this year to get Narcan. Thank God we were able to get some. But we found that in the very beginning, when we started JoCo Angels, we were able to get Narcan really pretty easily. But right now it's not as easily accessible. And we want to make sure that that one thing that can save someone from an opioid overdose is available to anybody that needs it. And we need to see that all EMS, police, and fire departments have that on hand on their personnel when they're responding to any kind of an overdose. So those are the things that we felt were important. We are right at about 8 minutes, and we wanted to make sure that we had time to answer questions. So
we actually do have 2 questions that came in the chat.
Okay.
One of them was, how much does it cost to attend Hope Center Ministries? And the fee for that, it is, like Kelly said, it's a 12-month faith-based program, and it is $700, which is why we are able to provide sponsorships to people going there. There's 3 phases to Hope Center. And during the second phase and the third phase, they're doing vocational training, like she mentioned. And so for the $700, they go there, they do the vocational training, and that helps to earn their stay at the home. And it also, helps for future residents to come, because it keeps everything going at the home. And then after phase 3, they graduate and they get to the $700 back, and they also get to keep their last 2 paychecks, unless something has changed with that, but that's the way I understand it to be. So $700 to go for a year, and then you get the vocational training, which they come out of those programs with full-time jobs, most with benefits, and the men and women are able to start their life over and find somewhere to live and rent. They have a little stack of money when they leave, so that they can get their life going again. We had another question. Does the program allow residents to be on medication? There's very limited medications that you can take when you go to Hope Center Ministries. You are not allowed to do any kind of MAT treatment there, so no Suboxone or methadone. So if you are on that, then it might not be an option for you. But as Kelly said, we do support all pathways, and for the price of it's a good program, especially for the price that you pay. Are there any other questions? Okay.
Well, we thank you so much for the time, and we put our contact information on this last slide. We welcome anyone to reach out to us if you're interested in starting your own type of this type of program where you can support your own community. That's really what our hope is that we'll see more people really wanting to do this in their own communities. So please feel free to reach out, or if we can help you in any way, we're here. We love to do that. So thank you so much.
Thank you.
What?
Well, I'm back, and as you can tell, I am not Shane. He had to leave, but I am filling in for him. My name is Marilyn Shannon, and I am the chair for PRISM and the People's Opioid Summit. So, I know that you're all enjoying this evening, and we have more in store for you tomorrow. Just some of the highlights: Josh Stein, our Attorney General from North Carolina, will be sharing information about the settlement, and then also we have Senator Jim Bergen from Harnett County will be with us tomorrow as well. Please go to the People's Opioid Summit website and you will see a full schedule of both tomorrow and Saturday. So coming up next is our next presenter, which is our final one. And this is Nina, and I truly love her. I mean, we've been working together for a while. I think you're going to find her very inspiring and interesting. She is her company is called Life Bites Global. She is an amazing speaker with a wide range of experiences and talents. She's a filmmaker, a broadcast executive and talent, a motivational speaker, and, hold on one second, I just lost my space. And she's written 2 books and has been featured on numerous television networks and publications. She's the founder and chief transformational officer of Life Bites Global, an organization that helps thousands of people in their lives and their journeys. And tonight she's going to talk about a special life and the life of Marilyn Monroe, which is really interesting and inspirational. And so now I'm going to turn it over to Nina.
Hey everybody, am I on? I think I'm on. Am I on live? All right. Hi everybody. I'm going to play this song for just a second, just so you can listen to this if you can hear it. No more concealing, no more hiding, no more shame. I thought this was an apropos song to start this evening off with, because there is an inspiration that we get, an entertainment that we get from watching movies. They inspire us. We look up to celebrities and we think to ourselves, oh my gosh, I love their talent. I love their looks. I love the way that they look and move in the world. But do we ever look at a life of celebrity for a teachable moment? A lot of times we're always talking about the tragedy. And certainly this year with Marilyn Monroe, there's a lot being talked about in relation to her about being this tragic figure. But today, what I'd like to do is have you remember that this woman was resilient, she was inspirational, and she was filled with hope. So today we're going to use the life of Marilyn Monroe. As Marilyn said, I am a coach I inspire hopefully people every single day in helping improve their lives. But I've been in media for all of my career, and I used to market these huge movies, and I would take celebrities and writers and directors and talk to them about how that movie relates to life. So today what we're going to do is we're going to take the life of Marilyn Monroe. And I was listening to the other speakers, and what an inspirational time for all of us to be together, because it does take a village to solve this huge crisis that's happening. So what I'd like to do is anybody that'd like to know more about Ben Thomas online, he is No More Hiding. And one of the reasons why I wanted to profile just a little bit of his song is that he is in the recovery space, in the healing space, and he has all these mantra songs for healing and hope. And I know that today, especially, there are people here with families. There's here people that are maybe either in recovery or still in the addiction phase. There's government officials, healthcare workers. We're all coming together to solve this crisis. And one of the reasons why I could talk about Marilyn Monroe is I'm the producer of a podcast called Marilyn Behind the Icon. And we're also doing a docuseries, and it's really around her mental health and addiction issues. So one of the things that is important to know, and you might have been seeing Marilyn a lot in the media this year, it's the 60th anniversary of the star's death. And this is one of her quotes. It says, "The true things rarely get into circulation. It's usually the false things." And so much about her is so much rumor and actually lies that if you go to the other side of the screen, you're going to read this quote, and it says, "I want to be loved more than anything else in the world." And I think that's why people are so attracted to Marilyn, because she's relatable. Because at the end of the day, that's what you and I, all of us, want to do, is feel loved and to feel like we belong. And so as we get to know Marilyn through what I know of her, and probably a little bit different than what you see in the tabloids and see in some of the mainstream documentaries this year, is that what does Marilyn have to do with mental health and addiction? Well, a lot of people just think, oh, she's a tragic figure. Oh, she had an alcohol problem. No, she had an acute mental illness combined with an addiction to prescription drugs. And unlike, the celebrities of today, I mean, it's not unlike the celebrities of today that are still dealing with this, or any human being that is dealing with a mental health and addiction issue. But part of the reason why I wanted to profile her today is most people don't realize, including myself when I first learned about her, is how resilient and strong and really inspiring she is. But you can't understand Marilyn until you understand her story. She was much more than that tragic figure. She was resilient, she was smart, she was talented, she was deep. And a lot of people don't know that about her. A legacy of mental health issues and challenge. So just to put it into perspective, her mother and her grandmother, as a baby and a toddler, tried to kill her. Her mother was institutionalized. Her father never acknowledged her. She was in at least 11 foster homes and orphanages. She was neglected, physically and sexually abused. She was institutionalized about a year and a half before she died. She was put in a straitjacket. And back in the days of 1960 in Payne Whitney, they didn't exactly have the treatments of today, especially in terms of a celebrity, in a padded cell. And we know of 3 times that she actively tried to take her own life. So at 36 years old, she died on August 5th, 1962. And I just want to put this thought out there to you, because in some ways we've come so far, and yet we haven't. And the reason why I say that is because back in 1962, the standards were a lot different, and yet we're dealing with such a crisis right now, and a different crisis than we were 20, 30, 40, 50, 60 years ago. So I'm going to back up the truck just a little bit and share with you a little bit about Marilyn Monroe that doesn't get highlighted a lot in the media, because what you hear is Kim Kardashian wearing that beaded dress, and you hear about JFK and Bobby Kennedy, and Marilyn Monroe was murdered. And the reality is Marilyn was a simple girl. She really was, that happened to be a huge movie star. But a lot of people don't know this about her. Marilyn stood up for civil rights. And some people know this story, and a lot of times it gets misconstrued in the media. But this little figure over here, this wonderful voice, this powerhouse icon in her own right, Ella Fitzgerald. Ella Fitzgerald gave Marilyn a lot of credit for launching her career, because back in the day, Ella Fitzgerald couldn't get into these big clubs. And a lot of people think it was because of race, but it actually wasn't. It was because the club owners thought that she was too frumpy. So Marilyn said, you know what, to the club owner, I'm going to go ahead and I'm going to bring myself, as well as my high profile stars like Judy Garland and Frank Sinatra, to come to the club and watch Ella Fitzgerald. They became friends. Marilyn Monroe admired her, and Ella Fitzgerald gives Marilyn Monroe a lot of credit for launching her career. This guy right here in the middle, if you can see my little cursor here, many people don't know who this famous person is, but he is an American jazz pianist, and he played at Happy Birthday, Mr. President for JFK back in 1962. And a lot of people don't know this either. This picture is actually a very famous picture that got shot in the newspapers a long time ago. This guy over here is Billy Trevia. And Billy Trevia is responsible for "Diamonds Are a Girl's Best Friend," right? So he literally created the costume for that along with other people, but a very famous costume designer. And he got Marilyn to go out to, back in the day, which would have been what it would be called a Negro club. Got shot in the papers. Daryl Zanuck, the president of Fox, was fuming. He threatened to fire Billy over it for taking his commodity to the club. So you know what Marilyn said? If you fire him, you fire me. You don't hear that story in the media, do you? So one of the things I want to highlight here is she stood up for civil rights. She supported the military, she supported charities, and she supported the underdog. And I think that's why 60 years later, people still relate to Marilyn Monroe. The other thing that some people do know about her, but she loved children. She loved animals. I think that, and it's been said that after Marilyn Monroe had all this fame, she realized that's not really what she wanted. What she wanted was to be a very, very good actress. And what she wanted more than anything else is to love and to be loved and to be a mother. She loved animals. And here's a cute little story that I just heard over the last year, but it's been circulating around for a long time, just to give you a little insight of how she loved animals. So she was 16 years old. She was married to her first husband. And back in the day in Los Angeles, in the Valley, there was a lot of farmland and orchards and stuff. And so there was a cow outside. And it was raining really hard that night. And the cow was outside getting rained on. And Marilyn felt so sorry for the cow that she brought him into the living room so he couldn't get wet. So that gives you a little insight into Marilyn Monroe and the heart of who she is. The other thing that most people don't know about Marilyn Monroe is that on January 7th, 1955, she formed her own production company. I don't know about you, but I used to think that Marilyn Monroe was her character, that ditzy blonde that wasn't that smart. No, she was extremely bright, and she was one of the few women of the day. You got Mary Pickford, you got Lucille Ball, and you got Marilyn Monroe. Prince and the Showgirl was her only production that she did under that production. She went on to do Some Like It Hot. There's again Prince and the Showgirl, Bus Stop, and then her last movie, her full movie that she made, which was Misfits. So you get to see that this woman wasn't ditzy at all. She actually was quite intellectual. To give you a little insight into that, and I would actually suggest and invite you guys to do this, Google Marilyn Monroe's 400 books that she had in her library, and believe me, they are for the intellectual. She's extremely bright. She loved to read, and she had 400 books in her shelf when she actually passed away. The other thing that most people don't realize about Marilyn, and I think this is really important when you think about the depths maybe of your own pain, whether you are or have suffered from an addiction or a mental illness, or you have a loved one that has. This is Marilyn's soul. And I'm just going to read the first one, but you can certainly go to the right side and read the life one. But it's too bad. I feel sad when I got all my life behind me. If I had a little relief from this grief, then I could find a drowning straw to hold on to. It's great to be alive. They say I'm lucky to be alive. It's hard to figure out when everything I feel hurts. One of the beautiful things about Marilyn Monroe is back in the 1950s, she was probably one of the few, if only, stars talking about her mental illness and the legacy, her abuse, sexual abuse, standing up for civil rights. When back in the day, it was all about leave it to Beaver and Father knows best. People can relate to that because guess what? All of us hurt, and we're coming out of a pandemic. There's a huge crisis, epidemic in this world right now, not just here in the United States, but all over the world with addiction and overdoses and suicides. So I was listening to some of the statistics. I mean, we all have to work together, and we need inspiring figures that we can relate to that help us with our pain. And Marilyn has been that for a lot of people in their life. And so one of the things that I think that gets really washed and discredited, especially, I'm just going to say a big network right now highlighting a very big movie, television network. They forget that she was a human being. And, you know, I think the reality is that Marilyn Monroe, just like all of us, wants to be loved and accepted and to have that ability to be loved and to be accepted. And the other thing that she had, the duality of who she was, is that she was the largest, if not the biggest, movie star in the last century. When I talk to some of my younger interns and assistants, they all know who Marilyn Monroe is. But when I say, do you know who Clark Gable was? Do you know who Elizabeth Taylor was? Do you know who Tony Curtis was or Rita Hayworth? If you're 6 or 96, you're going to know who Marilyn Monroe was. Everybody in the world just about knows who this woman was. So we look at Marilyn Monroe and I say, why Marilyn? Why Marilyn? The celebrities, why Elvis? Why Prince? Why Michael? Why Anna? Why Whitney? Why my friend Nancy? You know, Marilyn and I were in a round table when I found out the day that my friend Nancy wasn't going to make it. Just happened. Beautiful soul, just like Marilyn Monroe, had everything going for her. Why my friend Jan, her daughter, who's a runaway right now, and she's fearful of her life and using drugs. Why my friend Alan's son, Brandon? Why my stepson, Brian? Why your son or daughter? Why your client or your patient? Why you? So when I look at this and I say, wow, there's so many resources, addiction, suicide, mental illness is at an all-time high. What can we do together? That's why I love this forum right now, for us to put our ideas together, to put our heads together. But it's going to take a big dream. It's going to take a bigger thinking to really solve this crisis. It's complex and it's not one-dimensional. So what is the answer? I know this, and I know everybody that probably is watching this knows this first one. You cannot want it more than the person you want to help. It took me a long time because sometimes I wanted it so much more than they wanted it. There's not one easy answer. It's systemic. We're not going to solve the issues of addiction and recovery by one answer fits all. And I think one of the things that in watching this, you know, the other speakers today, is that we have to get curious and we have to listen, we have to work together. And that means, legal, that means healthcare, that means mental health and recovery specialists, that means families. And I'm going to say something just as a coach who's not fully in the addiction and recovery space. People are hurting more than ever. And I think because of the pandemic, we've lost that human touch. And I think that if we can find ways and solutions to think out of the box, just because it was done one way 20 years ago, 10 years ago, 5 months ago, doesn't mean that's the answer to solve this epidemic. So we've got to really think outside the box. So I'm going to backtrack just a little bit. I'm going to go back to the Maryland story. So most people don't realize the role that Marilyn's doctors played in her death. Now, I'm going to say this. There are some wonderful, wonderful doctors as it relates to dealing with addiction and mental health. But I'm going to say, if you are a high-powered person, celebrity, etc., there's a lot of doctors, there's a lot of family members that enable loved ones. I certainly was one of those people. I would enable the people that I would love. And I like to say I'm a recovering enabler. And so these doctors, most people don't know this either, unless you're a true Maryland fan. She died from a mixture of chloral hydrate and Nebutol. And I want you to think about the impact of this. She was prescribed 900 pills 3 months before she died. 700 of them sleeping sedatives or barbiturates. You look at that from June 7th, and that's just 2 months. That was her list of medication that her doctors prescribed. You look at July 31st and August 3rd, there you go, chloral hydrate and Nebutol. Those two drugs should never be combined, let alone not administered and properly monitored by a doctor. And neither one of those doctors actually monitored her. Dr. Greenson, her psychiatrist, actually, you know what he would do? He would give her the bottle after taking out some of the pills out of her bottle and putting it into his pocket. Now, that was back in 1962. That might have been their standards. But today, we've got to think of better and better ways of how we can prevent this, not just from the outside in, but from the inside out. So in all of these discussions today and people's words of wisdom has, this is the way that we solve these problems. One person saying this, one group saying this, another group saying something else. And that's how we start to solve this. But I wanted to give you a perspective on Marilyn's diagnosis and her treatment at that time. Some people know this. She was diagnosed as bipolar. She also had symptoms of borderline personality with a depressive disorder, and she had what they call mixed episodes. And so when people say, oh my gosh, Marilyn Monroe was so happy, and then she could be so sad, that gives you an awareness that she wasn't just being difficult, she had a mental illness. And so when you think about Marilyn Monroe and you think about her childhood and what she came from, and yet she created this wonderful, wonderful career, bigger than most people will ever do in their whole entire lifetime. One of the other things that I want you to know about Marilyn Monroe, and I want you to start thinking about this in terms of your own life, and start thinking about Marilyn Monroe. She really did want to get better. But in 1962, they laced barbiturates into your vitamin injections. Okay. So it wasn't necessarily the standards of today. We have come so far, and yet we're still dealing with the same issues that we did back in 1962. But as a little girl, Norma Jean, she wanted to dream the hardest. She would go to the theater alone, 6 or 7 years old, all by herself, 9 o'clock in the morning, all the way to dusk, and watch sometimes the same movie over and over and over again, thinking to herself, I want to be Jean Harlow. Oh my gosh, Clark Gable, he might be my dad. She would visualize. So I think in some ways we have to visualize a better way for ourselves through this epidemic. I call her the ultimate manifester. Man, if all of us can manifest what she did. She also had a great mindset. She loved The Little Engine That Could. The Little Engine Could was one of Marilyn's favorite books. And Joan Greenson, the daughter of Dr. Greenson, her psychiatrist, loaned it to her on the plane. She took it as she was going to sing Happy Birthday, Mr. President. So you look at this bottom picture and you look at the beautiful Marilyn Monroe in that beaded dress. And guess what you see? This year, all you see is about Kim Kardashian. You see over here, these three pictures, JFK, Marilyn Monroe, and Bobby Kennedy. I want to give you some perspective on, when they say what is circulating is rarely the truth, right? And that's a quote from Marilyn Monroe. The truth is not out there. In this picture that's been cropped, by the way, Marilyn Monroe was actually standing next to her ex-father-in-law, Isidore Miller. She was married to Arthur Miller, the great playwright and writer. And Bobby Kennedy was next to Ethel Kennedy. But we don't see that big picture, do we? So again, we get caught in a little perspective and we think it's the truth. And somebody that might be dealing with addiction, dealing with a mental health issue, dealing with both, a family member that's at loss going, what in the world can I do? We've got to start to think bigger and broader and start to realize that there is hope, there is inspiration. You got to have a little bit of resilience. And I would say that Marilyn Monroe had it. If you think about everything that she grew up from and what she accomplished more than most people do at 36. Some people don't ever do at 96 years old. So it gives you a little bit of perspective into who Marilyn Monroe was. So now what I'd like to do is I'd like to bring it back to you. How many of you actually are feeling the challenges in your own life in dealing with mental health or an addiction? Or you are feeling helpless and not knowing how to solve this epidemic? When you think about, are you in the recovery space? Are you in the law and government role? Families, I know right now, are at a loss. And we're asking the question, what can we do to solve this epidemic? And so I'd like you to think about a dream you had as a little girl or little boy. My little, he's now 7, but at the time he was 4 years old, grandson said, I'm called Nani. Nani, I'm going to protect you. And he was all dressed up as Spider-Man. And when you think about that, he felt that. So I want you to think back. What was your dream at that time? Has it been realized? And here's the other thing. How big are you willing to dream today? Because not only do we have our own dreams, but we've gathered today to help us solve a huge crisis, not just in America, but in the world right now. So, are you still imagining? And do you have a dream of solving the opiate epidemic? There's a wonderful quote by Dr. Joe Dispenza. It says, the best way to predict the future is to create it. So we need a little bit of Marilyn's manifesting qualities to think outside the box and to start dreaming of a new way. Because if not, what's going to happen is it's going to be the same time, same bat channel. So when I was listening earlier to, the presentation in the Biden administration, when I was looking about families, when I was looking about how this crisis 20 years ago wasn't what it is today, we've got to start to connect these dots. Because if we work in our silos, and I loved what she said about, we've got to stop the politics. And we've got to come together as not as one side or the other, but as people. And one of the beautiful things about Marilyn and what people love her today, 60 years later, is that she brought that human quality. And I think that's what's missing in our society today. And I think that's what part of the challenge that we have in some of our young people. Heard a horrible story. You know, just right here in Los Angeles, Palos Verdes, a 16-year-old jumped off the cliff. 16-year-old, just last week. You know, we've got a lot here that we have to ponder. And it's not going to take just one person trying to solve it. So I'm saying this to you because I think that Marilyn has been so exploited in the media. And yet there is a human being in all of us. I don't care what celebrity you are, even the celebrities of today. So what I'd like you to do is you can either take out a notepad or I want you to make a mental note. What is one thing that is holding you back in your own dream? You know, I have this saying, you stop dreaming, you stop living, right? Because we always have to be feeling like we're creating each and every day. And Marilyn was extremely creative. And how about the gap where we are now in this epidemic and finding the right solution? And I'd like you to think about this, even if you're not going to write this down right now. I'd like you to go back and think about this. What are 3 things? And I don't want you to think about it too much. I just want you to make a mental note, even one thing that I can do to put into action. Because if we don't put our ideas into action, they stay wishes. And this time next year, we won't make a dent in this epidemic, and we have to make a dent. And it's going to take each and every one of us stepping up to the plate to make that dent. So the last thing I'd like to share with you in regards to Marilyn, and it is a question I'm going to throw back to you. But one of the biggest issues Marilyn Monroe had is that Norma Jean was the true Marilyn Monroe. Marilyn Monroe, the character, was an on-screen presence that engulfed her. And unfortunately, that also became the challenge in which she could not be her true self all the time. So I want to ask you a question, because it does start with us. Is there anything that you're hiding from the outside world, from people that are closest to you? How about even from yourself? And are you willing to be truthful with you? You know, I have been around addiction almost my whole entire life. It's in my family genetics. My ex was an alcoholic. My stepson uses prescription drugs and alcohol. My best friend died of alcoholism. So I remember managing. I also remember keeping quiet. So whether you are the person with the addiction, or you're the family member or loved one that is dealing with this addiction, I want to encourage you to find somebody that you can talk to, that you can start sharing and getting support. Because 2 weeks before my friend Nancy died, her son said to one of his family members, "I don't think my mom has much longer." And what happens is, as family members and loved ones, we become desensitized. And we've tried so many other ways to get help, and we feel helpless. So part of being authentic is being authentic with you first and foremost. And I know that Marilyn Monroe knew truly who she was, but she didn't know how to get the proper help, nor was she getting it at the time. But here's the hope. You can. You can get the hope. You can get the help. There's an AA term that says you're as sick as your secrets. And here's the thing. We got to bring it out to heal it out. Bring it up to heal it out. If it's inside, it's not going to go anywhere. So I'm going to encourage everybody here to be your authentic self. So what I'm going to do now is I'm going to share with you just some final words here. You know, Marilyn was a seeker. And unfortunately, you know, due to those protocols and treatments of the day, she did not get the proper treatment. Certainly she didn't after what I showed you. I also shared with you that she packed a punch. At 36 years old, I think she's probably created more than some people do at 96. But I want to remind you right now that we're in a world of a lot of chatter. And with that chatter, we forget our feelings. We forget what is coming up for us, and we get so easily distracted. So the beginning of this talk, I said to you, tragedy to triumph. And there's a question mark. And I think prior to my friend's death, I thought, of course, you know, the coach in me, yes, everybody can get better. But you know what? Some people will end in tragedy and some people will triumph. And that's just the truth. And so here's the one thing I do know is that triumph is a step-by-step process. You know how they say, take it one day at a time. I know this. Marilyn was strong. She was courageous. She was resilient. Her life ended in tragedy, but her legacy doesn't have to. You know, Marilyn was and is one of the biggest icons in the last century. But at the end of the day, she was a simple girl with a big, big dream. She wanted to be a great actress, but just like all of us, she wanted to belong, she wanted to be loved, and she wanted to be accepted. So it's my hope in this talk today that through these questions, bringing more of the human side to our world right now and to solving this and not to forget this. And I want to encourage each and every one of you to start to love yourself more. Love the people around you more. Get connected not only to yourself, but to your dreams again. Because you know what? We never know how much time we really have. And just like Marilyn, we all want to be loved and to love and to be accepted. So Marilyn would say, before she would go into a performance when she was really nervous, she would say, hold a good thought for me. So what I'd like to say to you is hold a good thought for Marilyn, hold a good thought for yourself, hold a good thought for the families dealing with this crisis intimately and up close. But let's hold a good thought that we can actually find a solution to end this epidemic. It's time. Thank you.
So I want to thank all of you that have been participating and listening tonight. Thank you so much for being here, all of our speakers. Thank you so very much for dedicating yourself and your time to us tonight. And I also want to thank our sponsors. They are very important to us in this whole process. So let me thank Claxado, a naloxone nasal spray, Sunrise Community for Recovery and Wellness, the Yana Connection, Morse Clinics, and our hosts here American Institute of Health and Fitness. And tomorrow, we'll be here again, Friday and Saturday. Please join us. Go to our website, peoplesopioidsummit.com, and you can find out all the different ways that you can register to join us. And we look forward to seeing you. Thank you so much for spending your time with us. Be here tomorrow. Good night.